Hello, this is Dr. Charif.Sidani. I'm a neuroradiologist. Thank you for joining me for my part 1B of my head CT lecture series. Target audience for this lecture is wide. Essentially, anybody who wants to develop a search pattern for interpreting a CT scan of the brain, whether it's first year radiology residents, neurology or neurosurgery residents, medical students, nurses, physician assistants, or radiology technologists, among others. Similar to all my lectures that will be posted on this channel, this is intended for educational purposes only. So in part 1A, we discussed CT scan of the brain. We discussed how normal structures appear and why, how pathological structures appear and why. We discussed the two concepts of calibration and windowing. In this lecture, we will discuss how or what is the best search pattern on a CT scan of the brain. What's the ideal search pattern and what's a suggested search pattern for beginners. So what's the ideal search pattern? In fact, there is none. You will be reviewing with multiple faculty, each of which has their own search pattern. The most important thing is to have a search pattern, and with time you can modify it and make it better fit your level of expertise. However, there are requirements for a successful search pattern, and in my opinion, those can be summarized into 4 points. Number 1 is knowing what's normal. Number 2 is developing a checklist of the structures you are going to review. Number 3 is choosing the plane that shows the anatomy or pathology to the best advantage. And number 4 is choosing the window level that shows the anatomy or pathology you're looking for to the best advantage. We'll start with number 1, knowing what's normal. Discussing or describing what's normal is beyond this lecture, and no single lecture can cover that. This is why radiology residency is several years. However, few points that you should realize for this lecture is normal can be a spectrum, gender, age play a significant role, and it's important. Symmetry is very important, but relying on it is not enough. For this lecture, we will emphasize what normal gray-white matter differentiation is, and I'll give you a few examples. So in this example, we have 3 cases. The size of the ventricular system is completely different between those cases, and the size of the cell size is different. Which one is normal? All of them are normal, but they're normal for the patient's respective age. If this was on a 12-year-old CT scan of the brain looked like this would be completely abnormal. Again, knowing the spectrum of normal takes time and a lot of practice. Another case where we see that the pituitary gland is prominent in both cases. Very similar appearance, however, in this 30-year-old pregnant woman, this is perfectly normal. However, in this 30-year-old man, this is pathologic. Most likely there is an underlying lesion. The third example is to show that just relying on symmetry is not enough. In this case, we see that the gray matter and white matter look exactly the same. Things are similar from side to side. In this case, structures look similar from side to side as well. The gray matter looks dark, the white matter looks bright. Both cases are symmetric, however, both cases are abnormal, and these are 2 examples of anoxic brain injury. This is what's normal, and this is what we will be emphasizing in this lecture. Gray matter and white matter have a normal appearance or a similar appearance relative to each other, regardless of the age, etc. With gray matter, whether it's in the cortex or in the basal ganglia, thalami, what we call as deep gray matter nuclei, is always dense, brighter than the white matter. The white matter, whether it's subcortical, periventricular, along the corpus callosum, or along the white matter tracts, is always darker. And this difference between the appearance or the density or the color of the gray matter and white matter, it's what's known as gray-white matter differentiation, and this is the normal that we will be emphasizing for this lecture. The second requirement for a successful search pattern is developing a checklist, which varies between one scan and the other. On a CT scan of the brain, this is my suggested checklist. So reviewing the scout images, reviewing the brain parenchyma for gray-white matter differentiation, which we just described, midline structures, looking at the extra-axial spaces, checking the arteries on a plane scan, ventricular system, dural sinuses, orbits, paranasal sinuses, mastoid air cells, the osseous structures, the soft tissues, and what we see from the upper neck. The order in which you review them is not essential. Some people review them in the same order regardless what the clinical indication is. Another way is to review them in an order depending on the clinical indication. For example, in the setting of trauma, start by reviewing for bleed. In the extra-axial spaces, in the setting of acute stroke, you start by reviewing the gray-white matter differentiation. The most important thing is to have a checklist so that you don't forget any item on that list. The third requirement is choosing the plane that shows the anatomy or pathology to the better advantage. What do we mean by that? When we do a CT scan of the brain, we scan an entire volume of the brain. Every structure is visible on every plane. So whether it's the axial plane, the sagittal plane, or the coronal plane, every structure is included on each of those planes. However, certain structures can be seen to a better advantage or evaluated more accurately on a certain plane. For example, we want to check the gray-white matter differentiation, compare structures from side to side. The axial plane gives us the best advantage to do that. If you want to evaluate the midline structures, the sella, the supracellular structures, the entire corpus callosum, cerebral aqueduct, the fourth ventricle, or the foramen magnum, we will be able to review them to much better advantage on the sagittal plane. Coronal plane provides, among many other things, great evaluation for the dural venous sinuses. You will find significantly hard time evaluating the superior sagittal sinus on the sagittal plane or an axial plane. So you go through your checklist and see which structure should be evaluated best on what plane. And last but not least is choosing the window level that shows the anatomy or pathology to a better advantage. And here we're going to take a minute or two to describe the concept of contrast resolution, and I will give you some suggested window levels for evaluation of CT scan of the brain. So the concept of contrast resolution is ability to distinguish between multiple densities in an image. In this case, system A and system B, we have a background, a square, very similar color or exactly the same color and exactly the same size. Now if we place those two circles which are of exactly same size, we see circle A to much better advantage than circle B because there's much better contrast resolution between the circle and the background. A second theoretical example before we see how this applies to CT scan of the brain is having this rectangle which is gray and having all those small squares which on this side of the screen look exactly the same to the other side of the screen. And I can tell you for a fact that those squares are of different density or different color from the background. However, this is not obvious to your eye. Look what happens when we change the background. So if we make the background black on this side, you can now see that the structures or all those squares are obviously different than each other and obviously different to this background on this side, the gray background. However, on this side, we cannot distinguish those squares from the background. There's more contrast resolution on this side because we changed the background. And just see what happens when we move this black background from one side to the other. Again, changing the background makes certain structures appear better or worse. Now, how does this apply to CT scan of the brain and developing this search pattern? So in this theoretical examples, we have a CT scan of the brain at the level of the frontal horns of the lateral ventricles, and we have this circle as a pathologic structure. There are 4 pathologic structures on this scan. If you can identify them, then that's great, but they are very subtle. However, look what happens when we change the window, when we change the background, or when we make the contrast resolution of the system better. Now, those pathologic structures show to a significantly better advantage. And this is what we mean when we say that we have to choose the window level that shows the anatomy or the pathology to a best advantage. And now we'll give some real life examples. So if you're reviewing this CT scan and checking the brain parenchyma very well, you will not be able to see the soft tissues simultaneously. This is the exact same level, now windowed differently. We can no longer see the brain parenchyma very well, however, we see the soft tissue abnormality. And this is the exact opposite case, in which we see the soft tissues very well, however, we cannot see the brain parenchyma or the parenchymal pathology and anatomy very well. When we changed the window for that case, we realized that we lost this gray-white matter differentiation that we were discussing earlier at the level of the insula and subinsular region, and this is a case of acute infarct in the middle cerebral artery distribution that we missed on that other window. Another example, reviewing the brain parenchyma on those two windows, we can easily miss this bone lesion. We cannot appreciate its size, extent, or matrix on those windows. However, we can easily evaluate it on the dedicated bone window algorithm. And the final example is on this window, we can see that the patient has small extraaxial collections, subdural collections. However, we cannot see the fractures associated with them unless we change to a dedicated window. Okay, so what are the window levels that are needed to fully evaluate the CT scan of the brain and not miss any structure? In my opinion, there are 4. The first one is what we call the parenchymal or stroke window. And if you look carefully, you see very good gray-white matter differentiation. This is excellent for evaluating parenchymal abnormalities. On the other spectrum, we have a soft tissue window in which we now see the soft tissues very well, in this case the soft tissues of the scalp. However, we no longer evaluate the gray-white matter very well. We still cannot evaluate the bone very well. There's a window in between, which I call the intermediate window, and I'll show why this is important in a second, in which we evaluate the gray-white matter to a lesser extent. However, this is very good for evaluating extraaxial collections, and as I said, I'll show you in a second. We still can't evaluate the bone window on any of those. We cannot evaluate the soft tissues on the intermediate window. And last but not least, there's the bone window algorithm and reconstruction, in which we see the bone very well. Now we start seeing the cortex and the medullary cavity, but we completely lose evaluation of the brain. So why is this intermediate window important? Or how do we go through a scan reviewing all those 3 windows? So in this example, which was a trauma, patient has subdural collections, we start by evaluating the parenchymal or stroke window. We see the gray matter, the white matter, see that there is nothing in the brain parenchyma at this level. I suspect that there is blood in the extraaxial spaces. However, with this particular window, you can see that the bone creates this margin of ill definition around it, so I can't see the extraaxial spaces very well. I'm scrolling through this stroke window to see what's happening, and then I switch to this intermediate window where I see the gray-white matter differentiation to a slightly lesser extent. However, the margins near the bone are more well-defined and I can see the extraaxial collections very well. I still cannot evaluate the soft tissues very well, definitely not evaluating the bone on this window. Now that I saw the extraaxial collections, I want to evaluate for any soft tissue injury. I move to a soft tissue window, which shows me the subcutaneous soft tissues. I can see the subgaleal hematoma. And finally, to a bone window image. That can show us the associated fractures in this case. These are the 4 windows side by side. The parenchymal window, which shows us gray-white matter differentiation very well. However, the margins to evaluate the extraaxial spaces near the osteostructures is limited. An intermediate window, where evaluation of the gray-white matter is slightly limited. We cannot evaluate the bone. However, we can evaluate the extraaxial spaces immediately underneath the bone because they are less blurry. A soft tissue window, in which we no longer can evaluate the gray-white matter. Very difficult to evaluate for extraaxial collections. We still cannot evaluate for bone. We're limited to the evaluation of the soft tissue structures. And finally, the bone window, in which we can evaluate the osteostructures, fractures, osseous lesions, but nothing else. So now that we have this knowledge of the successful search pattern, the windows that we use in this pattern, what is my suggested CT brain search pattern, particularly for beginners. One is by starting and reviewing the scout film. This is very important. Sometimes the scout film includes things which are not included on the axial images because the scout film covers a larger area. Review the axial images with the 3 different windows. On the parenchymal window, concentrate on reviewing the gray-white matter differentiation. On the intermediate window, concentrate on evaluating the extra-axial spaces. And the soft tissue window provides good evaluation of the orbits, scalp, and the fat planes. Arteries, looking for a dense artery, atherosclerotic arteries, or a clot, and the ventricular system can be evaluated on both the parenchymal and intermediate windows. Once you're done with that, evaluate the sagittal images to look for the midline structures. And finally, the coronal images to evaluate the orbits, the dural sinuses, and the tentorium. And of course, your review of a CT is not complete without evaluating the bone window, looking for fractures, the paranasal sinuses, mastoid air cells, the temporomandibular joints, and if any part of the cervical spine is included. So with all that in mind, let's review an example. We said that the first step is reviewing the scout film. The scout film is a general survey. When the patient is first placed in the CT scanner, a general survey is obtained of the area of interest, after which the technologist selects a particular area to be scanned. This area is represented in the blue frame. Everything within the blue frame is going to be available to you in axial, sagittal, and coronal images. However, everything outside the field of view of those frames is only available on the scout scan. Often, the scout shows abnormalities within those field of views. So, for example, in this case, the endotracheal tube was low. It was at the level of the carina and should be adjusted. In this particular case, the findings were more significant. Patient had tracheal deviation, and workup showed that he had a thyroid malignancy. And this is probably one of the most important take-home points from this lecture. Reviewing the scout film. This applies to CT scan of the brain or any other CT you're reviewing. Now that we're done with the scout images, we'll move to the second item on our checklist, the axial images. We review them in parenchymal window, intermediate window, and soft tissue window, and cover all those structures. I usually review the bone window separately, but I'll include that in the review of the axial images in this particular case so that you guys see a comparison of what each window shows. So in this particular case, we're starting at the level of the ventricles. I like to start with the parenchymal window, or as we said, the stroke window. So you change the window to your preference until you see a very nice gray-white matter differentiation. See the thalami, the basal ganglia separate from the white matter, whether the corpus callosum or in this case the posterior limb of the internal capsule. You can see this gray-white matter differentiation at every level. Now if you look carefully, the margins adjacent to the bone are blurry. We don't see them very well. As we said, on this window we can evaluate the ventricles, the gray-white matter. We can evaluate the vessels if we have the setting of stroke and we're looking for a dense MCA sign. Now that we're done with that, we want to evaluate the extra-axial spaces, moving to an intermediate window where we have not so great differentiation between the gray and white matter. However, the margin adjacent to the bone is more defined. Again, the parenchymal window, the margin near the bone is blurry. Moving to the intermediate window, we still cannot evaluate the soft tissues. And on this window, in addition to the extra-axial spaces, again, visualizing the ventricles for small amount of blood within the ventricular system, visualizing the vessels is also good. Moving to a soft tissue window, we now lose the gray-white matter differentiation. Very bad window for evaluation of the brain parenchyma itself. However, we can evaluate the subcutaneous fat planes. We can evaluate the orbits, what we see from the upper neck, and what we see from the cervical spine. See the parotid glands, which in other windows we wouldn't have seen. As I said, I review the bone window separately, but for the sake of the discussion, if we move to a bone window with the same axial images, now we can evaluate the paranasal sinuses very well. All osseous structures, whether is it for fractures, for lesions, the joints, temporomandibular joint, mastoid air cells. And this is the same case with all windows side by side, the parenchymal window, seeing the gray-white matter differentiation very well. Again, looking at the extra-axial spaces near the margins of the osseous structures, we don't see the extra-axial spaces very well. The intermediate window, where we do not see the gray-white matter very well, however, the margins of the extra-axial spaces adjacent to the osseous structures are very well seen. Scrolling through those images, we see that on those two windows we do not see soft tissue structures. We cannot evaluate the fat planes around the orbit. This is clearly seen with the soft tissue window. Again, if you want to evaluate the upper neck and the parotid glands, at what we see from the cervical spine might be difficult on the first two windows, but very well seen on the soft tissue window. And finally, on the bone window, clear visualization of the paranasal sinuses, the mastoid air cells, and the anatomy of the osseous structures. So the next step is evaluation of the sagittal images, and this is the most important sagittal image. It's the mid-sagittal plane. Evaluation of the midline structures, best seen on this image: the cella, the supracellular structures, the corpus callosum, the cerebral aqueduct, fourth ventricle, the cerebellum, foramen magnum if there is a tonsillar ectopia. In this particular case, not much of the cervical spine is included. In other cases, and I'll show an example, we include more portions of the cervical spine, and the sagittal plane provides adequate evaluation for that as well. Next on the list is the coronal plane. I like to evaluate multiple structures on this plane. The orbits, when you have a soft tissue window, evaluation of the orbits is very nice. You can see the extraocular muscles, the fat planes, and the optic nerve or optic nerve sheath. Going more posteriorly, adjusting the window to evaluate for the superior sagittal sinus. You can see the entire course of the superior sagittal sinus. This is also an important image, another good view of the cell and supracellular structures. Again, the entire course of the superior sagittal sinus, which might be very difficult to visualize on the axial or sagittal planes, and evaluation of the tentorium. Sometimes blood in the setting of trauma would be layering on the tentorium, or if you have a tentorial meningioma, this provides an adequate plane for its evaluation. Moving on for evaluation of the bone window images, we already saw the evaluation of the axial series, mastoid air cells. Evaluation for fractures is probably best on this plane. Paranasal sinuses. On the sagittal plane, in this particular case, a large portion of the cervical spine was included, so make sure to evaluate that. Going to the periphery of the series, always evaluate the temporomandibular joint on this plane. And finally, on the coronal plane, we can evaluate whatever we see from the facial bones, the paranasal sinuses, the margins of the orbits. We can see the skull base structures very well on this plane. So in summary, it is very essential to have a search pattern. You can design your own search pattern. You can adopt a pattern that somebody else uses. It's important to have a search pattern for the CT scan of the brain and for every scan you are going to encounter. Requirements for a successful search pattern is knowing what's normal, and in this particular case we covered gray-white matter differentiation. Please keep in mind that gray matter is denser, whether it's the cortex or the deep nuclei, compared to the white matter. Have a checklist, choose a plane that shows the anatomy or pathology to the better advantage, and choose the window level that shows the anatomy or pathology to the best advantage. This is my suggested CT scan of the brain search pattern. You can develop your own. Scout film, going through the axial series, through the 3 different windows. Make sure not to miss any structure. Sagittal images, essential for reviewing the midline structures. And on coronal images, I like to review the orbits, the dural sinuses, and tentorium. And of course, do not forget the bone window images. Evaluate the bone for lesions or fractures, the paranasal sinuses and the mastoid air cells, the temporomandibular joints, and whatever is included from the cervical spine. If you want to keep learning about neuroradiology, subscribe to this channel and check additional videos. I'll also be posting links to self-assessment modules, so make sure to check those as well.